The Evergreen Media Network Studio, powered by Scott Tree Services.
No one told me that.
No one told me that.
No one told me that. In pregnancy highs and lows,
We are tackling the I didn't knows
it's the No One Told Me podcast
with Janay
and Tay.
Hi, everyone. Before we start this podcast, I just want to take a moment to thank Jesse for my ice. Thank you, Jesse, so
When you're
much.
6 months pregnant, right, Janay, you need someone to look out for you with your ice. I love that. Thank you, Jesse. You're the best.
He really
You're
is.
welcome, no problem.
All right, so welcome back to another episode of No One Told Me with Janay
And Tay.
In this episode, we will be talking about everything centered around what to expect when you deliver at Cleveland Clinic, Indian River. They have so many resources within their hospital that so many families and moms and dads, they're not aware of. And I don't even know that a lot of them know how to go about finding these resources. So that's what we're going to help you guys discover today.
Yeah, absolutely. And again, we're so grateful to live in a community that offers all of these resources. So it's my pleasure today to welcome our featured guest, Mary Volsky. She is the nurse manager of women's health care at Cleveland Clinic, Indian River Hospital. So thank you, Mary, for joining us today. Go ahead and just share a little bit. You have quite a credential list and experience. So please share with everyone your experience and kind of your role at the hospital now.
So I was actually born at Indian River Memorial Hospital.
Wow.
And have lived in the community here for the majority of my life, other than college and serving a mission for my church. I've been here in Vero Beach. When I graduated from nursing school, I immediately started at Cleveland Clinic. I have a long 30-year history now at Cleveland Clinic, Indian River Hospital. Of course, it was Indian River Medical Center beforehand, which includes medical surgical nursing, intensive care unit for 3 years. And then in 2001, 2002, I found what really brought me joy, which is labor and delivery and women's health care. So I have worked in women's healthcare since 2001, 2002. So that's about 22 completed years, working on 23.
Awesome.
And I love taking care of moms and babies and families.
Amazing. Well, we can't thank you enough. I see what the nurses go through and just the work that you guys do. And, you guys truly have an amazing heart for the work that you pour out to our community.
I have some really wonderful nurses that work with me.
Yeah.
We have a really good nursing team, and we also have a really good provider team.
Yeah.
So we do end up working really well together as a team to make sure all of our moms and babies get the best care.
Thank you.
And I know that Mary is very passionate about her job because she's the one who started the magnesium treatments on me back in 2020. I tried to convince her to let me go home, and then she had me shipped right to Longwood.
Thanks, Mary. Put her in her place.
I remember that. I remember you giving me fits.
I will tell you, the entire ride, I was extremely hot, but all I remember is asking the paramedics, could you guys please just drop me off home?
No.
But they wouldn't.
If that doesn't describe you, I don't know what does.
I was like, please, I just need to go get my food. I was like, please take me home.
That is a true depiction of you, Janay.
That is perfect.
I love that.
Oh, God. So to begin with, all the services that Cleveland Clinic has to offer to the families, could you just shed a little bit of light on the tours that you guys offer?
Yes. So we have a maternity tour and meet and greet on the third Saturday of every month. It starts at 1:15 in the afternoon. I tell all of the moms when I talk to them to come a little bit before that because it's really tight to get everything done in that time period. And there's usually a line. So you do have to get a little sticky saying, hey, I'm at the hospital. During that time, we tour the unit. We answer all your questions that you may or may not have. We get to see every part of it, labor and delivery, our mother-baby unit, and our nursery. And you also get to meet some of the hospitalists that are working that day, and the nurse midwives that are working that day.
Awesome.
It is interactive. We also have the Fatherhood Initiative usually comes, and the doulas usually come, so that they can talk a little bit about how we partner together.
And I think the most recent one is this weekend, correct?
It is, actually. It is. Normally, it's either myself or one of a couple of nurses that will do the tour.
Awesome.
This Saturday is going to be me, and it actually is really interactive and really fun.
Great.
And there's no RSVP. They just kind of show up for that.
So it's really helpful when I have an idea of how many people are coming. So you can reach out to me personally at the hospital. At that hospital number is 772-567-4311, and my extension is 6759. And then I'll even email you a link, or not really a link, but an invitation, so that you know when and where to arrive.
Perfect. Well, thank you. Well,
And I know
maybe
Mike
someone will-
sometimes brings goodie bags
So
for the family.
Yeah.
actually, every time, everyone that attends gets a little goodie bag from Healthy Start.
Yes, that's super fun. And I'm sure that just gives ease to parents, and expectant mothers looking at the facility and the hospitalists and really all the staff involved, just to give them peace of mind and ease into what their experience is going to look like.
Absolutely. I think that no matter what reason you end up in the hospital, whether that's to have a baby, which is a joyous occasion, or if it's for some other medical concern, no matter what, there's fear associated with it.
Right.
It's nerve-wracking. You don't know how things are going to go. So anything that bridges that gap so that you have a better experience is really important.
Yeah, absolutely. So I know that we focus a lot, and I feel like just within maybe the past 5 to 8 years, birth plans have become more of a bigger thing. And implementing those into hospitals sometimes looks a little different based on the hospital, but I know that Cleveland Clinic Indian River really honors those. So when a mom comes in labor and she's, getting into the labor and delivery room, how does the nursing staff communicate and honor her birth plan?
So I actually talk about birth plans during the tour also.
Okay, great.
So when I first started labor and delivery 22 years ago, birth plans were like, oh no.
Yeah.
This is not good. Now there's no such thing as a cookie cutter a patient or a cookie cutter delivery. It's not like you can do your stamp. This is going to happen. This is going to happen. This is going to happen, and this is going to happen. In order for nursing and the providers to really provide that patient-centered care, to ensure that each patient has the experience that they are seeking, we need to know what you want to have happen.
Right.
I tell moms, write things down. Have a birth plan. When you come in, give it to your providers, right? Give it to the doctors in the office. When you come in, bring a copy of it. Give it to the nurse that you meet with. And then make sure that at change of shift, every time that there's a handout, make sure you reinforce that what you want your experience to be. If we don't know what you want, then it's really hard to make sure that you have that experience.
Right.
So it is super important that you communicate that with everyone.
Yeah, absolutely.
I always say that there's no right or wrong way to have a baby.
Well, and that's a beautiful way to look at it, because not everyone wants that traditional way of delivery. And, I think there's so many people that are moving to maybe a more holistic view, but want the hospital setting. So I think that's wonderful that you guys are just so open and offer that autonomy to the patients.
So that is very important, right? Sometimes some things in a birth plan might not be possible, right? Or maybe we just need to talk about that before anything is initiated. So it's really important that you have that. And then let's say there's something on there that isn't really conducive with what you're there for. So that nurse would have a conversation with you, or I would have a conversation and say, I see that you would like to, I'm going to just say, not have an IV in labor. But it's really important to have access because you never know what will happen.
Right.
And you don't want immediate care, delayed in order to get an IV in.
Right. Yeah, absolutely.
I agree. And so we know that our Grow Doula program was adapted into Cleveland Clinic, and we are considered part of the care team and not necessarily one of their plus ones in the room. I don't know how you guys really word that. What do you guys consider them?
So they are part of the healthcare team. We love doulas. I wish every patient took the time or took the opportunity to have a doula with them. It is so nice to have that individual support right at your bedside, in addition to your significant other or your family or whoever else is going to be in your delivery. These are trained professionals. The doulas are trained. And I have seen more than once a successful vaginal birth because the doula was right there adding the support at the time that it's the hardest, where sometimes moms want to give up.
Right.
Outcomes are better with doulas. Or that labor support.
Right.
Breastfeeding is more successful and implemented more when you have that additional labor support.
I know.
Yeah, it is.
So,
well, Janay, you can speak to that too, just being a doula yourself and doing...
I know. This Friday, we actually... what day did I go into the hospital for that birth? It was like a 16-hour birth that I was there, but she was there for like almost 24 hours. And it was so hectic. There were 3 moms on the floor.
Yeah.
And it was like they all went into labor at the same time. And I'm like, with my doula client, I'm like, wait a minute, hold on, don't push this baby out because I cannot catch it. Both Mary and Dr. Malabé, they were in the other rooms. And so I went and found Mary. I'm like, somebody's got to get in here because she's ready to push.
And we just get the doctor in too.
Yeah.
So that was a nice delivery.
It was. Dr. Malabé was amazing, and he's so empowering. I've never had a birth with him, but it was really great to see, a man empower a woman throughout her birth, because that's a very vulnerable time for a woman.
It is.
It's very vulnerable.
It's probably one of the most vulnerable moments in a woman's life. The pain, because all childbirth is associated with some discomfort, no matter what you use for pain management, whether that's Lamaze breathing or IV pain medicine or a labor epidural. There's still some discomfort, right?
Sure.
And it's so vulnerable that you either lift them up during their experience or the other happens. There's no status quo.
Right.
So it's important that all of our providers, whether they're nursing or OBs or our midwives, and we have a great set of midwives that work with us, are empowering our moms to be able to be successful.
And we kind of touched on how some individuals want a more holistic approach. And I know you equip the room with several different tools for, let's say someone wants to have a more natural, even if they have an epidural, what tools do you provide in the room, in each laboring room, that the mom can move around on and utilize?
Absolutely. So every room has a labor ball. So that you can use a labor ball to help be comfortable during the early parts of labor. Rotating your hips on that labor ball, I say that's laboring that baby down, right?
Yep, that's right.
We have peanut balls, so that they're balls that are shaped like a peanut. So when you are in bed, it kind of helps keep your hips in alignment, and it keeps moms more comfortable. I'm sure that, Janay, you're kind of 6 months, right? So when you lay on your side, are your hips getting more uncomfortable as you lay on your side because of that they're just not in even alignment? So the peanut ball really helps with even alignment. We have something called a cub chair. And a cub chair stands for comfortable upright birthing. It is the coolest thing. It's like a horseshoe shaped pillow, and it can be about, I'm going to say,
It may be a little bit thicker than that.
well,
It's pretty tall.
it can be
Yeah.
twice
You
the
can- I
size,
guess
but
you
you
can
can
make
do
it,
one
yeah.
side, one level or 2 levels. You can sit on it. You can use it to support your belly when you're in hands and knees. We also have squat bars that can go onto our bed, so moms can help squat. It can help position them during squatting. There is no reason why a mom has to lay flat on her back in the bed the whole time.
Yeah.
We also have something called a Novi. I don't know if you've heard of that
No,
before.
actually.
Novi is
It's so cool.
telemetry monitoring. So it's a little patch that goes on mom's belly,
Okay.
and it allows us to monitor baby's heart rate, mom's heart rate, and uterine contractions without being tied to the monitor. They can move around in the room, and we can still have fetal heart tones.
Wow.
So Taylor, I don't know if you've ever been in a delivery room with a mom. So they usually have these belly bands, and there's a pink one and there's a blue one, and they both have this like little circular thing that they have, and it's hooked up with cords leading to the monitoring system to monitor like baby's heartbeat, your heartbeat, and all that this other stuff. But with the Novi, it's a Bluetooth,
It is.
and so they stick it on you, and then they connect it to the system so that you have that mobility.
Wow. No, I don't know that. I mean, I'm aware of the bands, but I did not know that
It's
existed.
a newer technology,
Okay.
or not so new,
Yeah.
but we have had it for the last, I want to say 4 or 5 years.
Okay.
But it does give mom more ability to move around.
Yeah, that's so important, especially with the tools that you're providing.
Nothing is more miserable than just staying in one position.
Yeah.
Especially
like
when
you
you're
have-
It
pregnant.
makes it a lot easier, especially when we doulas, when we're doing different
Comfort
exercise
measures.
comfort measures with the client. They're not confined to the nurse constantly running in. Oh, we lost your baby on the monitor. We had to get you readjusted.
Well, we still have to do some readjusting to monitor, but it is another tool. It's another tool in the arsenal of keeping you comfortable and
Yeah.
moving.
It is. So Mary, can you talk on the hospitalist programs at Cleveland Clinic, what they entail, and the benefits of them?
Absolutely. So previously, before we started with the OB hospitalist and midwife model of care at the hospital, we had the physicians at Partners in Women's Health. They would spend a day in labor and delivery, and we would call them when we needed them, or they would stay in the hospital but go home when they weren't needed. And then we would talk to them whenever a patient would come in. So this is called a hospitalist or a laborist model of care. So that allows an OB laborist to be in-house basically 24/7. So when a patient comes in, they're readily available to take care of them. In addition to the OB hospitalist model of care, we reinstituted a midwife model of care. So I know you've mentioned a couple of times Taylor. I wanted to say
call me
Tay.
Tay. I like that.
A couple of times about that more holistic measures.
Yeah.
It is so wonderful to have midwives because they have a different way of dealing or managing or helping moms. And so they come in and they may be the one that's doing your delivery. And they allow you, it's really empowering. It is really an empowering moment.
Yeah.
It is.
So we have a midwife and a doctor on every day.
Okay.
And then they're here so let's say something happens and you need emergency care. We have them readily available. It's the safest model of care.
Yeah. I love that we have. How long have we had that?
I'm really bad with time.
Yeah.
So
But not like years and years and years. This
no,
is...
less than 4.
Okay.
And I want to say maybe 2.
Okay.
I want to say like 2.5 at the most.
Okay. Awesome.
I'm really bad with time.
That's okay.
It's all right.
I just knew it was more recent. I thought so. It was more recent. So I love that that's implemented into our community's care. Now, there's a lot of question when moms deliver about, are they going to get immediate skin to skin time? And what happens with the concept of delayed cord clamping? So I know obviously for medical reasons, not every mom gets that initial skin to skin. Is that correct?
So let's start, instead of the skin to skin, let's talk with the delayed cord clamping. Every baby gets delayed cord clamping. You can put that on your birth plan, absolutely. Where I encourage you to. Just know that is the process. The only time that we would not do that if there was a reason why like a medical reason why we needed to get the baby to the warmer or something very quickly. Okay. Skin to skin is we prefer going straight skin to skin. We ask you, do you want skin to skin? Some moms would prefer their baby to be cleaned up first. Sure. That's okay. Again, that's why the birth plan is so important, so that you tell us what you want. Yeah. Otherwise, baby, as long as everything's good, goes right up to mom's skin and can stay there. There's no reason why baby can't stay on the chest. Yeah. We just can't weigh the baby. So if you go, hey, how much does my baby weigh? Just no, we're not going to do that while they're laying on the chest. That one, we haven't figured out how to do that kind of a scale yet.
Not yet, right?
So we love skin to skin. We can do everything we need with baby right on your skin. Actually, I'm currently working on becoming a certified lactation counselor.
Oh, that's so amazing.
So exciting.
And just last night, while I was at home doing some of my CLC training, I watched a video of a baby with that initial skin to skin and how they just scooch
the breast
themselves
crawl.
over.
Yes, I think we watched that in the doula training too.
They just scooch themselves or crawl or leap. Or
it's just the instinct of the baby, right?
They do, and they latch themselves on, which is it's a beautiful thing.
It is.
So my nurses are really passionate about allowing you to have that kind of experience.
Awesome. Well, that's great.
So after mom delivers baby safely, and she's done her skin to skin, her first latch, what services are offered for the mom and the families moving forward, like bedside?
That's actually, I'm not 100% sure I understand what your question is. What do you mean?
So as far as, like, does anyone else come into the room?
Oh, yes. Okay, thank you. Wow. Thank you for explaining. So we have lactation counselors in-house. They see every new mom, no matter what their feeding choice is. We encourage breastfeeding. Every one of the nurses also have completed 15 hours worth of lactation training, 14 or 15 hours. That would be one of the first services that are there. Additionally, one of the maternity navigators from Healthy Start will also come and see those moms. They offer, which is amazing, a home visit from a nurse. So in between the time they go home and the time they go to see partners or the provider again, there's a nurse that will come to their home and check out to see how they're doing, take vital signs on how the baby's doing, weigh the baby, so that it helps you feel more comfortable knowing that both you and your baby are healthy. And then we have a birth certificate clerk that comes to each one of the new moms, and they make sure that the birth certificate is completed in a timely manner, and also that we spell your name, your baby's name.
Awesome. Well, that's great. Well,
and me. So either myself or one of the leadership team that I work with, we make rounds to check on you. Okay. And see how your experience is.
Yeah. And then if mom does get to a place where, she's had some assistance bedside lactation wise, gets home or successful in the hospital space, right? Gets home and is struggling maybe
they
a couple
can totally
days.
Call us and also our lactation team. So
there's always 24/7 support for moms who are looking to be successful in breastfeeding. Absolutely. Well, I am so grateful for our conversation today, Mary. Thank you for all of your wisdom and knowledge in this field, and thank you for serving our community as a nurse and medical professional. So we've really enjoyed our conversation, and I know we love working with you closely in the Healthy Start space
to deliver my baby.
Stop that.
I will, girl. I'll special you.
You and Megan, Dr. Taylor.
All right, you guys. Well, a couple things I wanted to just announce before we leave. We have launched officially our free pregnancy and postpartum app. We have partnered with a company called Yomingo. They have done a lot of the background work for our app, and this is free to the community. So I encourage you all to go to our website at www.irchealthystart.org. Go to that tab that says download our free app. It's going to take you to a registration form. You're going to fill out that registration form to then get login credentials. You'll download the app and you have access to free resources. You have a contraction timer, a packing list, an abundance of things. So please utilize that. If you found out you're pregnant, if you're 6 months pregnant and you want to utilize it, go ahead, because there's so many resources that are beneficial to the moms in our community. And even beyond that, even if you're listening and you're not in Indian River County, please feel free to still utilize this resource. And lastly, we're hosting 2 events on June 8th. The first one, we are doing a maternal health brunch from 10:30 to 12:30 at the Gifford Community Center. And that is going to be a wonderful discussion around preconception health, interconception health, mental health, and just the importance of prenatal care and OB care. We have 3 panelists that are going to be there. We have Dr. Daniel, Dr. Crystal Taylor, and Shantae Thompson, who are going to be speaking on these topics. So we really encourage you to please consider coming to that. And if so, you can RSVP to Janay at irchealthystart.org. And secondly, if you are currently pregnant, expecting, or parenting a child between 0 to 12 months, please feel free to come to our community baby shower. That is also going to be on June 8th from 2 to 3:30, as well as the Gifford Community Center. So please RSVP to that as well. And you can RSVP to me for that at Taylor at irchealthystart.org.
And you guys can also head to our social medias to find out more information.
Yep, we've posted both of those on there.
And I'll be there representing Cleveland Clinic Indian River for the community baby shower.
You will. I just spoke to Liz this morning, so perfect. All right, guys. Well, if you have any other additional questions in regards to our conversation today or the 2 events coming up, as well as the app, please feel free to reach out to us. We're happy to always talk with you and give any advice or connect you with some of our programs if that's your ask. So thank you so much for listening, and we look forward to seeing you next time. We will see you next month.